Hello and welcome to reporters and the public watching this virtual news conference. I'm Jessica Lovell with the University of Kansas Health System. During this half hour, we will be joined in studio by Tammy Peterman. She is the president of the Kansas City Division here at the University of Kansas Health System. Also Dr. Steve Stites, Chief Medical Officer for the health system, and Dr. Lee Norman. He is the Secretary of the Kansas Department of Health and Environment. Kansas U.S. Senator Jerry Moran had hoped to join us here in the studio, but instead he is joining us live from the Senate studio in Washington, D.C. Senator Moran, thank you so much for joining us. We're glad you're here. I want to get started with you. Negotiations in the Senate are ongoing for phase 3 of this package. Give us an update on where the Senate stands right now with that.
Jessica, thank you. Thank you to KU Health Systems, and thank you to our panelists for our second week in a row of bringing this program and an opportunity for the press and media to ask us questions. I wish I was with you, but the negotiations continue. I would have expected to have been on a plane this afternoon and in the studio with you by this time, but it hasn't worked out that way, and that's not always surprising in the United States Congress. There is a plan that's in front of the Senate. It is pending, but negotiations are ongoing, generally between the White House and the Democrat leadership, plus the Republican leadership of the Senate, to try to formalize this piece of legislation. This is round 3, so we've talked in last week's program about phase 1, phase 2. This is phase 3, mostly designed to deal with the economic consequences, both from a healthcare point of view and from an employment point of view in this country of COVID-19. And so front and center in this, really, I would say 2 components are front and center. You can't expect small business and individuals to bear the burden of a global pandemic. And so this legislation is designed to provide some financial security, some ability to get by while this circumstance is being faced by Americans, citizens and American business. So primary of interest is getting money to people so that they have something to live on, pay the rent, buy the food. This legislation provides for some direct checks to folks at some of the medium to lower income levels. It's phased out over higher incomes. So a direct check to individuals. Secondly is the effort to provide loans guaranteed by the SBA, the Small Business Administration, to small business if they agree to keep their employees on the payroll, not necessarily working, but on the payroll. Those loans can be forgiven. They are guaranteed by the SBA. And so this is an effort to perhaps make it more likely. I started to say guarantee. There would be no guarantees, but make it more likely that a business can afford to pay the salaries, the wages of folks who work for them. And if they do keep those individuals on the payroll, be reimbursed at a later date after they prove that. And then there is unemployment benefits that are increased. The unemployment benefits increased by $600 per week for the next 13 weeks. There are independent contractors and sole proprietors who are now included under unemployment insurance. And finally, some delays in the payment of student loans for those who are students for the next 90 days. So a gamut of ideas put into legislation, waiting for the Senate to pass, and these negotiations involve getting the Speaker of the House and the House to have some agreement to them so that they can pass the House of Representatives once the Senate completes its work, which I hope is still yet today. I would say, though, that nobody is going to feel, let me say it this way, the economy can't recover until people feel secure in their health, till they understand that their family is safe and secure, that there's a well-being, a sense of well-being. And so in addition to the efforts to try to stabilize the economy and make certain that people have an opportunity to pay their bills and keep their jobs, the other part of this is to make sure our healthcare providers have the necessary resources. And a couple of points I'd make here is there is $75 billion available to healthcare providers who are at the forefront, bearing the brunt of treating and dealing with people who need to be diagnosed as whether or not they have the virus. In addition to that, additional money for the Food and Drug Administration to move forward in getting tests more rapidly completed, to find any additional vaccines or cures, to do the science, but mostly to speed the process along by which what other people do in the healthcare world can be approved by the Food and Drug Administration more rapidly. So this is a package, both economic and healthcare, and I would guess that our healthcare providers that are on our panel that I'm joining today would be pleased to know that if this legislation passes, there is some financial support to take care of the tremendous circumstances they and their staff are facing today in Kansas and across the country.
Thank you, Senator Moran. We know you're very busy in Washington, so thank you for joining us live from there. But stick around because we have some reporters that have a lot of questions for you.
I'll do it.
So we'll get to those in just a bit. And reporters, remember to send your questions for our panel to the email address provided in the media advisory. Also include your name and your news agency with those questions, please. Let's get to Dr. Lee Norman. Welcome to you. Given the national scope of this pandemic, how is Kansas doing relative to other states in the nation?
I think we're responding very well, actually. This is a unique situation, the likes of which I've never seen before. It's called novel coronavirus for good reason, in that it's novel. It's usually the things we take care of, they can be good, they can be bad, but they're routine, and we can handle them through routine mechanisms. But this one is an organism we've never seen before. We don't know exactly how to predict what it's going to act like. We know other coronaviruses. SARS back in 2003 and 4 came on like gangbusters and fizzled out. The Middle East Respiratory Syndrome coronavirus didn't even peak until year number 4 of its existence, and it's still going on 7 years later. So one, what's it going to act like? And we cannot answer that with 100 degrees of certainty. The second thing is that social media these days drives so much in terms of people's opinions, and it hasn't been high quality information out there for the most part in social media, and that's why I'm so enthusiastic for gatherings such as this and working with healthcare providers everywhere, because it's everything that you hear from one extreme, which is it's just nothing, it's just a media scare, it's a hoax, all the way to the other side of it, which is it's a tsunami that's going to wash us all away. And in reality, how Kansas is doing, we're kind of the middle of the pack or better. We look at the number of cases per 100,000, i.e. a per capita case count. We only have 82 patients in Kansas at this time. The pundits and the forecasting would suggest that we're supposed to double that, or if we mimic other states, Washington, New York, California, perhaps Illinois and others, then we would be doubling that case count about every 3 or 4 days, and we haven't done that. We've been below that. The other feature about this illness that is so different in this infectious disease emergency is that it's unmitigated by the traditional methods of vaccination and medications. So we have to rely on public health principles that are hundreds of years old, and the ones I know you've heard. Some people have embodied these very well. Many people have said, I'm not going to pay attention to it, and those are the people that are tending to get sick through travel or through contact with surfaces or not distancing themselves. So the plea I would have is we want to continue to do well as a state, really pay attention to these public health practices. We will eventually have a vaccine, we will eventually have antiviral medications, but we're just not there yet.
Dr. Norman, thank you. We want to hear a few words now from Tammy Peterman about the impact of this virus on hospitals and our health system. Tammy?
Sure. Thanks, Jessica. The number one priority of our health system, the University of Kansas Health System, is always to make sure we're providing safe care to our patients and always a safe environment for our staff as well. In addition to caring for patients with COVID-19 or those suspected of having COVID-19, we're caring for thousands of other patients in our health system. Here's what we're doing to make sure people are safe. We've further restricted access to our health system to only those who really need to be here. We've restricted our visiting hours to the number of visitors at our hospital to 0, except in very certain situations. I know that's a really hard one for all of us. We're monitoring our employees and visitors as they come into our health system. We're taking everyone's temperature. We've postponed elective surgery. I think this is a really important situation. We've really postponed elective surgery, not because it's unsafe, but because we're trying to conserve our PPE, our personal protective equipment, and other supplies as well. We've reduced our ambulatory clinic visits, and we're expanding our telemedicine capabilities across our health system, from primary care to our specialists as well, so we can meet the needs of the community and beyond. We're monitoring our supplies on an ongoing basis. This is really important. We've heard about this across the country. We know that people are watching their supplies closely. We're doing the same. We're also working with healthcare leaders in Kansas City and across Kansas and beyond, because we know we can continue to work and learn from one another. We've connected with a lot of community leaders, and I think that's really been important because they've shared their support and their expertise and their donations. We've connected with community leaders like Tyler Notberg and his group of peers, as well as Jonathan Thomas at American Century, and so many others across Kansas City. Here's what I do want to tell you that's going on in our health system. We've taken care of several patients who've tested positive. We know that 2 weeks ago we took care of the first patient who tested positive in our hospital. Last week, I think we started the week with 2 patients who had been positive in their testing. This morning, we started our day with 8 patients who had positive tests. But the number of patients, PUIs, patients under investigation, is the number that's tremendously increased over the last 2 weeks. 2 weeks ago, I think we had a handful, and this morning, I think we had 40 patients who were waiting on test results. We have to remember that we're using a lot of supplies and equipment for those individuals until we get the results back and know whether they are positive for the novel coronavirus. We also know that there are a lot of ambulatory tests that are going on, and many patients can stay home. Once they're tested, even when they're positive, they can stay home because they can be well cared for in their home. We're monitoring what's happening on the coasts and across the country, and we're preparing because we know there will be an increase in inpatient bed utilization in our city. And we're working with not just our hospital to be prepared, but with hospitals across the metropolitan area and beyond. Dr. Stites might mention this as well, because I know he's working with a group of medical leaders in the facilities across Kansas City. But here's what I know. We have this really great city, and we need to do what we always do, which is come together as we are, because we can have an impact on this. We can bend that curve. We know that. If we follow the instructions and we follow the guidance, we can have an impact, and we can truly make a difference right here in Kansas City.
Tammy, thank you. We're going to get to your reporter questions here in just a moment, but first we want to hear a few words from Dr. Steve Stites. Dr. Stites, how important is it that people stay home?
There is nothing more important from a public health perspective that you can do as a society than stay home. I call it the doorknob principle. You know, if you go out, you don't know how many people have touched that darn doorknob. It could have been at the grocery store, the package in front of you. It could be any other button that you're going to push. But really, that doorknob. When you're at home, you have control over your environment. What we have to do, because we can't stop being a little fearful, because we're all scared about the coronavirus, we have to channel that fear into trying to help all of us work together to control it. And the way to do that is to stay home and keep your distance 6 feet away, wash your hands, don't touch your face, all those things we keep talking about. Those are the basic public health principles that really do work. And it comes down to that darn dirty doorknob. If you're not touching it amongst a group of people, then your risk of getting that virus is a lot lower. When you're at home, you're in a much safer environment. You can try to control that environment. And even if someone else is sick in your house, then you can try to put them in a part of the home that keeps them a little isolated. Coronavirus doesn't jump across time and space. It doesn't crawl across the carpeting. It has to have some form of direct contact from one person to another. So if you stay home and you isolate, then we'll have fewer cases. If we have fewer cases, we flatten the curve. If we flatten the curve, we can make sure we can take care of people so that the hospitals and the intensive care units don't get overwhelmed with volume. It is incredibly important to follow that shelter at home, stay at home policy. Do that, avoid the doorknob principle, and make sure you follow the great public health principles that we know work. And at the end of the day, we can channel our fear into being healthier and doing the right thing. And that'll help us get through this crisis faster and better.
Dr. Stites, thank you so much. Our first 2 questions tonight are for Senator Moran. in Washington. This is from Kansas City Star reporter Brian Lowry. Senate Democrats have argued that the Republican-crafted stimulus bill does not offer enough aid for cities and states. Would you support an amendment to increase the amount of direct aid to cities and states?
Well, Brian, I do know that that is one of the stumbling blocks in getting this resolved. I'll come back to that point in just a moment. But a vast majority of this money that in this bill goes to state and local units of government, hospitals, community health centers. The money is directed local. Remember back in our very first phase, we were taking care of the county health department and the Kansas Department of Health and Environment. That effort will continue in this bill, but I would say, to bring it back to where we started, I'm very interested in getting this bill done, and I wouldn't say that this is an issue that would keep me from voting for the bill. I want it resolved. I want the American people to know that we have their interests at heart, that we can set aside the differences and get a bill done. Overall, even if there are things in the bill that I might disagree with or I think are not helpful, overall the bill, the legislation will be of benefit, significant benefit to Kansans and to Americans. And so this is not an issue that would keep me from voting for the bill. And I'm always encouraged by things that are done at the local level as compared to the federal level. So as we can encourage, provide resources at home, I think that's a good idea. One of the things I would worry about, and I don't want to turn this at all into politics, but we have a lot of states who've overspent their budgets, don't have or are in significant deficit spending, and I would want to make sure this money is going to be used specifically for dealing with COVID-19, not just bailing out a state that has a financial problem already existing.
And another question from Brian from the Kansas City Star. Why have so few test kits been distributed to Kansas, and what can be done to rapidly increase the number in the state following Dr. Norman's announcement last week that the state was in danger of running out?
Well, Dr. Norman is the expert, and I have relied upon him for many years to give me advice, and we've had this conversation as well. I would say that what I've been doing is trying to get the kits that are available and can be sent to Kansas. And we've had some success in doing that, getting them out of the federal stockpile and sent to Health and Environment in Topeka. And that's one role I'm playing. We've gotten the FDA to make their approval process much shorter, and we've seen a number of instances in which manufacturing, businesses that manufacture test kits or can manufacture test kits now have the approval to do so. And as we speak, they're coming off the line in more rapid frequency every day. We also have become a conduit. Last week I held a conference call with the public health departments of all the counties in Kansas, and the feedback that we're getting about the test, how long it takes to do the analysis, how do you get the exam, how do you get the specimen from western Kansas to the Topeka, and who else can do the analysis besides the Kansas Department of Health and Environment. We're all communicating with each other and trying to get those questions to where they belong. And finally, I would say that not a day goes by. Certainly today is an example in which people have reached out to me, generally Kansans, but sometimes people from across the country saying, hey, I have manufacturing capabilities. I think I can do this. Who do I need to talk to so I can get the ability to start manufacturing tests or do the analysis or create the reagent or to do the swab? And so a lot of innovation and a lot of innovative people are rising to the occasion. I would defer to Dr. Norman, but I also would say that perhaps, let me say one thing first about the test. I've been concerned for a long time that the answer of who should be tested is based upon how many tests we have available. That's necessary. We started at a woefully inadequate supply, and we can't use them where they aren't the highest priority. But I do want to know what the CDC would say. If we have more tests, then what should be the protocols for who gets tested and when? But I would point this out and then turn the microphone, the program over to Dr. Norman. The shift has occurred from testing. The conversations now mostly revolve around PPE, what Tammy Peterman said about the personal protection equipment that is in short supply as well. And so I'd be glad to hear my colleagues on this panel tell you, but also tell me what the next steps are.
Dr. Norman, I think that means you're up.
Yeah. Well, first off, I'd like to thank Senator Moran. He has been very helpful, and we have not run out of testing equipment for the virus. We've come very close at times, and to be honest, we have had to adjust our testing protocols to make sure that we didn't run out, so that we had the people that were guaranteed to be tested, hospitalized patients, the people that are older, first responders, healthcare personnel, the people that are mission essential, if you will. We've had just barely in time shipments from FEMA, from the Strategic National Stockpile, literally semis, but as quickly as those offload, they go back out. One day we did 12 counties, the next day we did 20 counties in terms of going through the emergency management. I think in an ideal world, it's what Senator Moran talked about, which is we are looking at it, how do you manage a disease? What I would like to look at is not only how do we manage a disease, in this case an epidemic, but what do we know about the communities? Do we do community surveillance of well people just to find out where does the virus live? Are there asymptomatic people that carry it? Are there people that shed the virus? And we have not been able to do broader community surveillance like we would like to, but now we have a number of different commercial tests, commercial companies online that will do that testing. It's unencumbering our lab. To the senator's point, FDA has approved some point of care testing, and as soon as we get it through the CLIA approval process, we plan to roll it out more broadly for a much more rapid turnaround and much broader use, because until we do more community surveillance, we aren't really going to know the prevalence of the disease.
Dr. Norman, another question from the Star asking if people adhere to this lockdown in the Kansas City region, how long would it take to flatten the curve?
We don't know. Matter of fact, there's no great resource that tells us that. We've looked at Singapore, Hong Kong, South Korea, and those three have the most experience with it. Italy hasn't been doing it for long enough. In theory, 28 days or 30 days, 2 of the incubation periods for the virus should see a flattening off, but we are not deep enough into that at this point.
Also, one other for you, Dr. Norman, the Topeka Capital Journal asking about people talking about having to make tough choices, possibly withholding ventilators from seniors. How would these choices be made? What about claims of treatments that will resolve the coronavirus, like going to the chiropractor?
Well, the latter one I don't think we can really abide by because there's no evidence that that would work. The former one is a difficult decision. We do and have, in time of peace, prepare for war. When we have looked at what we call crisis standards of care, what are the guidance we can give that are ethical, that are kind for making those end-of-life decisions? We know, for example, that an 80-plus-year-old that gets on a ventilator with coronavirus is very unlikely to survive. Does that mean that we abandon the patient? Heavens no. So we try to do the best we can with the most people. We've not gotten into that bad situation yet. We have standards that we've gone through and have worked with ethicists and doctors and others, and hope we don't get to that position. And I'm optimistic that we won't, actually.
All right, Dr. Norman, thank you. Dr. Stites now. KCUR reporter Alex Smith asking if the hospital staff are being tested for COVID-19, and do we have enough supplies?
The answer to that question is that if a staff member has symptoms of COVID-19, then we will test them. So that way we do. We don't routinely test otherwise healthy and well patients. Supplies is a critical issue for all of us, and I believe that as of today, we do have enough supplies. The question is, how high will the curve go, how fast? Because the curve can easily outstrip the supply chain in this country, and that's really what we wrestle with every day. That's the reason we canceled elective surgeries. That's the reason we stopped ambulatory care visits so much, so that we could conserve our supply so we can make sure we can take care of those patients. That is, I think, the key issue that we face as a country, is how will we get supplies to the areas that need them the most across the country as this wave moves from the coast back into the center part of the country.
All right, Tammy, a question for you. Fox 4's Cher Kongor, she is asking if the health system, where are they as far as masks and protective clothing for the people who work here? And also, are we accepting donations for supplies?
Great question. As Dr. Stites just mentioned, we are keeping a very close eye on every bit of our protective supply and equipment because we know how important that is. And so at this very moment, as Dr. Stites just indicated, we have what we need. But we're monitoring this because we know that everyone in the country is trying to increase their supply of certain masks as well as gowns and gloves. Some of those things we have more of than others, so we're watching that very closely. It's the reason we have reduced the need in our operating rooms by reducing our elective surgeries. I think that one of the things that our community is really great at is wanting to give and support one another. So we've had a number of calls for donations, and we are so happy and thrilled actually to receive those donations. Many of those N95s we are putting to use. We're so grateful for those, and we actually have even established a designated email for people to send us their requests or their thoughts about donating. We're also working with our infection prevention and control team because a lot of people out in the community are saying, I can make some of these things. If you just let me know what I can do, I'll make those. So we're working with our infection prevention team to better give guidance on what that could look like as we move forward. We'll continue to put that information out because we are grateful for the individuals in our community who want to give to our patients and to our staff.
All right, Tammy, thank you so much. Okay, so anybody can jump in on this one. A lot of stations asking right now when the virus will peak, how fast will it taper off?
I think that's yours, Dr.
I think it is.
Well, we've done a lot of modeling, and what I think we have generally come to is that the statistical probability is that it might not peak until even as far out as February of 2021. The big question is, and the whole modeling depends on it, is this going to be seasonal or not? Will this drop off in April, May, June? And it brings up the question, where does seasonality come from? Why does influenza drop off? And there's a variety of things that suggest that maybe a lot of that has to do with school kids still being in close approximation, and they adjourn, and that's when they start dropping off. We don't know with 100% certainty. I think we're going to see continued growth for the next few weeks. It wouldn't surprise me if we were at 300 to 400 patients even the first part of April. And if it isn't seasonal, I'd expect it to peak out in probably January, February of 21.
All right, Senator Moran, I have a question coming in from Hannah Brandt. She's with KSNT in Topeka. What are the must-haves that you are pushing for in this bill?
Well, what I would say is I am supportive of the provisions, most of the provisions that are in the bill. They aren't drafted by me, so they're not exactly, all of them exactly what I would want. But I want to make sure that the things that matter to the people at home in Kansas are included. Today I was on the Senate floor and I spoke about the importance of not forgetting about agriculture, the challenges that we face for farmers and ranchers is significant. Prices have dropped. The estimates by university analysis indicate that we've lost $8 or $9 billion in the last few months to cattlemen and women across the state of Kansas. They are important in getting food to the grocery store ultimately and us fed. So, I mean, there are things that are specific to Kansas that we're paying attention to. But I would say, particularly here in front of the panelists that I'm joining, is I want to make sure that our healthcare professionals have the tools they need to care for the individuals who need their care. And that means helping them in any way I can in regard to the protective personal equipment and in regard to the tests and to make sure that those numbers go up. The problem is they didn't exist before in significant enough numbers, and it's hard to turn that around quickly when there's a worldwide demand for the same things we want. They're wanted in China and South Korea and Italy and across Europe and around the world. So we have our challenges there. The resources, the dollars, when KU talks about elective surgery being eliminated, what that generally means is their revenue, not just KU, but every hospital in Kansas that's treating COVID-19 patients, every one of them has lost revenue that comes from performing the surgeries that they do on an ongoing basis. And that's why this bill, among other reasons, is so important to get done now, not later, get done now so that they can have the resources necessary to stay in business and meet the needs as we work to flatten that curve that they're available to treat Kansans. And so the list is long. I think this is a series of things we're going to have to do over a period of time.
Senator Moran, before we have to let you go, we just wanted to have an opportunity to hear some of your final thoughts this evening.
Well, my final thought, I suppose, is I would welcome any input from our panelists, and the media is welcome to ask questions through my press secretary if there are things that they want to talk about. But I'd say I hope the bill is on its way to passage as I walk out the room.
All right. Senator, thank you so much for joining us from Washington this evening. Our panel here in Kansas City want to talk with Dr. Lee Norman. Do you have some final thoughts for us this evening?
Well, I think it's really important to pay attention to what's going on. As I mentioned earlier, there's so much bad information, and I give the public a lot of credit for rolling with it, because when testing criteria change yes or no, you hear good news, bad news from other countries, and it's really important to look and listen to high quality patient information sources. And I know our KDHE website, kdhe.ks.gov, we update it every day. It tells you what's going on in the community, very high quality. I know the KU Health System website, similarly high quality information, and pay attention to that.
We appreciate Senator Moran a lot, and I'm so glad he was able to participate via teleconference. And we also appreciate everything that KDHE has done, and I think that's really important. I think, Dr. Norman, having accurate information available as real time as we can is so important. It's important to our health system. It's also important to the public every single day. So we're trying to provide that. We thank you all for also helping us get the message out. I think some of the things we talked about are really important. You know, we need to stay in. We need to listen to some of the things Dr. Stites just said. You know, let's pay attention. We have to pay attention to everything from the surfaces we're touching to the doorknobs we're opening. So I think all of those things will make a difference in our city and beyond.
Dr. Stites, your final thoughts tonight?
Channel your fear. We can do this. There are so many good examples how countries have helped flatten this curve, and Kansas and Missouri, we can absolutely do this. And so we just have to be cognizant and thoughtful of all the things we do in life. We cut our surgeries, decreased our revenue, because we knew that we had to be ready for this when it comes. We can all do that together. Channel your fear, stay at home, stay safe.
Well, thank you to Senator Moran in Washington tonight and our entire panel. We want to also thank all of you for watching. This concludes our virtual news conference.